Physical therapy, their goal, of course, is to make somebody as independent and as strong as possible. They focus on leg strength, they focus on balance, they focus on ambulation, gait, various devices that people might need, whether it's a quad cane, crutch. I think everybody sort of can, physical therapy is a little bit easier to grasp. Occupational therapy, focus on function, focus on the arm because we do things with our hands, coordination, ADL. And speech therapy, of course, they're focusing on language. Speech pathology involves the treatment of speech, language, communication disorders, as well as swallowing and cognitive disabilities. They're the ones, they're looking at oral motor control, they're looking at if someone needs a modified diet, they're the ones who will be working on that. The important thing is that we work as an interdisciplinary team. There is crossover and there are things that we double up on. For example, at Health South, there's a feeding and a lunch group for people who aren't able to feed themselves and or have difficulty with the regular diet. They'll be in the treatment room with a speech therapist. While the speech therapists are analyzing someone's control, we're always looking at aspiration. They might put stimulation on a person's throat to always upgrade the diet. They're going from the softest diet normally up. The OT might be in there to look at the physical aspect of their ability or inability to feed themselves, whether they're distracted, whether they're having a neglect and they're only eating on part of their plate, or just the actual act of making their hand go to the mouth. And like I said, we would give out adaptive equipment, maybe a two-handled cup, a cup that has a top on it. So there is a lot of crossover. In the outpatient aspect, the speech therapists, when they work on cognition and executive functioning, they're working with the patient, I don't know how to explain, more in a 2D realm with practice and sequencing, where the OTs then take that and work in a practical sense. We actually do the laundry. We actually prepare a meal, whether it's looking at a menu, planning a catering party, ordering off a menu, figuring out the tip and the tax. We work together and hopefully we're communicating, and when you're in, whether it be OT, PT, or a combination, you know the difference between the two.